All right, welcome to this deep dive. Today we're tackling how nutrition, psychology, and sleep all kind of work together, especially as we age.
Definitely a fascinating area.
For sure. And to get into all this, we're diving into Chapter 8 from Integrative Geriatric Nutrition.
Oh, great chapter.
Yeah, it's already got me thinking differently. It's all about how if we can ditch some of that old school medical thinking, and focus more on our diet, gut health, lifestyle, that can seriously impact our mood and sleep.
It really can. We're talking about getting to the root of things, not just Band-Aid solutions.
Totally. So first up, let's talk about depression in older adults. There's this quote that just stopped me in my tracks. It's from Dr. Uma Naidu. She's a nutritional psychiatrist over at Harvard Medical School.
Okay, yeah.
She says, until we solve nutritional problems, no amount of medication and psychotherapy is going to stem the tide of mental issues in our society. Whoa. Right.
Powerful stuff. It really highlights how our understanding of depression is evolving,
Yeah.
We used to think it was all about low serotonin levels.
Right.
But more and more, research is pointing to inflammation as the real driving force.
So that makes me wonder, those traditional treatments like SSRIs,
Yeah.
which focus on boosting serotonin,
Yeah.
maybe they're not the whole picture.
Exactly. Studies show that only about 30 to 45% of patients with SSRIs alone actually see all their symptoms go away.
Wow, so that means a lot of people are still struggling.
They are, unfortunately.
And this is where things get really interesting, the gut-brain connection.
Oh, for sure.
Did you know 95% of your body's serotonin is actually made in the gut?
It's wild, isn't it? And that whole world of bacteria living in our gut, the gut microbiome, it plays a huge role in all this. Basically, what you eat directly affects your mental health.
Mind-blowing, because it all goes back to that gut microbiome, which then messes with your serotonin and ultimately your mood.
It's all connected.
So it's not just in our heads.
Right.
The book also mentions this thing called the depression, isolation, malnutrition triad. It's specifically talking about older adults. Have you seen that in your work?
Oh, absolutely. It's like this vicious cycle. Depression makes people isolate themselves.
Right.
Which then often leads to poor nutrition. And you can guess what happens next. That poor nutrition just fuels the depression even more.
Wow, so it's this whole tangled web. It really shows how important it is to look at the whole person, not just one symptom in isolation.
100%.
And one thing that really surprised me is that, in older adults, depression doesn't always look like sadness.
Interesting.
It can actually show up as just not functioning as well or withdrawing from everyone. So that's something to watch for.
Yeah, good point.
So, okay, if we're trying to move away from relying only on medications, what does nutrition for depression actually look like?
Well, the foundation is really a balanced diet.
Okay.
But it's got to be one that specifically targets that neuroinflammation we talked about. And it should also help heal the gut and support overall healthy habits.
Makes sense. Now, the book goes deep on specific nutrients, even has a whole table 8.1, breaking down how they work. There's a lot there. But for you, what are some of the real superstars?
To me, omega-3s are a game changer.
Okay, yeah.
And probiotics. We see time and again that people diagnosed with depression and anxiety, they often have lower levels of omega-3 fatty acids in their systems.
Interesting.
So upping your intake through things like fatty fish.
So we're talking salmon, mackerel, sardines.
Yep, all those. Even supplements can help if it's tough to get enough from food.
Good to know. What about probiotics? I always hear those are good for gut health, but how do they tie into mental health?
Think of probiotics like tiny messengers that help your gut and brain talk to each other better.
Right.
They can actually make a positive difference in the gut-brain axis, which is super important for feeling good mentally.
I've heard of that axis, but it's always sounded kind of mysterious.
Well, it's basically the highway of communication between your gut and your brain. And you can get probiotics from fermented foods like yogurt, sauerkraut.
I love a good kimchi.
There you go.
Now, the book also mentions fiber. I know it's good for, keeping things moving.
Right,
But it helps with mental health, too.
It really does. Fiber is amazing because it actually does two things. It reduces inflammation.
Right.
A and D feeds those beneficial bacteria in your gut. It's like a 2-for-1 deal.
So more fiber means a happier gut, which means a happier brain.
You got it.
I like it.
Yeah.
Okay, let's shift gears a bit and talk about anxiety in older adults. The book brings up a kind of scary trend. They say there's a lot of overprescribing of benzodiazepines for anxiety in this age group.
Yeah, it's definitely a concern. You see, benzodiazepines are on this list called the Beers criteria. It basically means these drugs should be avoided or used very carefully with older adults.
Why is that?
Well, they can have some pretty nasty side effects. We're talking things like feeling drowsy during the day, memory problems, and they can even make falls more likely.
That's serious. So if those aren't the best option, what are the alternatives? How do we help older folks manage anxiety without resorting to meds that might cause more problems?
Well, that's where lifestyle changes come in. And no surprise here, nutrition plays a big role too.
Makes sense.
The fascinating thing is the specific mix of bacteria in your gut can actually influence how anxious you feel.
Really?
Yeah, a gut with lots of different types of good bacteria, it actually produces more of these things called short-chain fatty acids.
Okay. What are those?
They're anti-inflammatory, so they actually have a calming effect on the body.
So it's like those butterflies in your stomach people talk about when they're nervous.
Exactly.
That's a real physical manifestation of that gut-brain connection.
Totally. The book also suggests it might be worth looking into food sensitivities as potential anxiety triggers too.
So someone struggling with anxiety, maybe they should get tested for food sensitivities, or even try an elimination diet to figure out if certain foods are making things worse.
It's definitely worth considering, especially if someone notices a pattern between certain foods and their anxiety flaring up. And let's not forget about the impact of weight and BMI on anxiety.
Oh, right.
Carrying extra weight can contribute to both anxiety and that neuroinflammation we talked about.
Makes sense. Extra weight puts stress on the body, which can then affect the mind.
Exactly.
Okay, so we're trying to avoid those benzodiazepines. What should people be eating to manage anxiety? The book points a finger at the standard American diet, the SAD, as a major culprit.
Unfortunately, yeah. The SAD, with all its processed foods and unhealthy fats, it's seriously lacking in fiber and those anti-inflammatory phytonutrients that are so crucial for a healthy gut and balanced mood.
So it's basically setting us up for inflammation and maybe even more anxiety.
Too much.
Okay, so what are some specific foods to avoid if anxiety is a problem?
Stimulants are a big one.
So we're talking coffee, energy drinks.
Yep, all of those. And it's tough, I know, giving up that morning coffee. Any food sensitivities you have, particularly gluten, should be avoided as well. Chemicals from preservatives and artificial flavors can also trigger anxiety in some people. And of course, alcohol and those high glycemic foods that spike your blood sugar and cortisol, those should be limited too.
Got it. So those are the no-nos. What about the good stuff? What can people eat that actually helps with anxiety?
Fatty fish, like we talked about earlier, are fantastic. Salmon, mackerel, they're packed with omega-3s.
Yeah.
High fiber foods are essential. Things like beans, raspberries, avocados, whole grains, all those feed those good gut bacteria we want to cultivate. Fermented foods are great too. Sauerkraut, kimchi, yogurt.
Got it.
And some people find that foods high in tryptophan, like poultry and soy, can be beneficial, as well as magnesium-rich foods like nuts and leafy greens.
I'm guessing calming herbal teas, like lavender, passion flower, chamomile.
Absolutely. Those can definitely have a relaxing effect.
Now, Table 8.2 in the book goes deep on nutritional supplements for anxiety. There's B vitamins, L-theanine, GABA, inositol, and a bunch of botanicals listed. It's kind of overwhelming. Is there anything from that table that particularly stands out to you that our listeners should know about?
One interesting point is that L-theanine, which you can find in green tea, can be really helpful for anxiety.
Right.
But sometimes it's the caffeine in green tea that can actually cause problems for people.
So maybe decaf green tea would be a better option for those who are sensitive to caffeine.
Exactly.
And the book also points out that some people can actually have a sensitivity to methylcobalamin, which is one form of B12, and might need to try a different form like adeno or hydroxycobalamin instead.
That's a great point. It really highlights how important it is to pay attention to your individual response to things. What works for one person might not work for another. Now, speaking of individual responses, let's move on to insomnia. This affects something like 30 to 40% of older adults. It's kind of a close cousin of anxiety, wouldn't you say?
For sure. And it's not just about feeling tired. Insomnia can really mess with your mood, your ability to think clearly, your whole well-being.
Definitely. And unfortunately, a lot of insomnia cases in older adults are tied to other health issues they're dealing with, or medications they're taking, or even disruptions in their environment.
Right.
It's all connected.
The book mentions that chronic pain and insomnia go hand in hand a lot.
Yeah.
Something like 50% of older adults who struggle to sleep also deal with chronic pain. It also talks about iatrogenic causes, which basically means insomnia caused by medical treatment.
Right.
So that could be anything from medications that disrupt sleep to being in a hospital where it's hard to get a good night's rest.
Yeah, all of those things can contribute. It makes figuring out how to treat insomnia in this population a real challenge, and it shows how important it is to try and address the root causes, not just the symptoms themselves.
I agree. Now, the book is pretty clear about the risks of using hypnotics, like those benzodiazepines we talked about earlier, to treat insomnia in older adults.
Yeah.
It sounds like they can cause a whole slew of new problems.
The potential downsides, like that daytime drowsiness, memory issues, and the increased risk of falls, those are pretty serious, especially for older adults who are already more vulnerable to those things.
So if we're not relying on those types of medications, what can we do to help older folks sleep better?
Well, there are quite a few non-pharmacological approaches we can try. I think a good starting point is understanding how sleep patterns naturally change as we age.
Right.
Table 8.3 in the book outlines some of those expected changes in sleep architecture as we get older. Total sleep time tends to decrease, deep sleep decreases, we wake up more throughout the night. It's all part of the natural aging process.
It paints a pretty clear picture of how sleep evolves as we age.
It does. And those shifts can make older adults more prone to insomnia. So it's important to take a holistic approach that takes all of these factors into account.
Makes sense.
The book really emphasizes that sleep problems in older adults are usually multifaceted. It stresses the importance of those non-drug therapies, like exercise, light therapy, cognitive behavioral interventions, and of course, addressing any underlying medical conditions that might be contributing.
Right. It's about getting to the root of the problem, not just trying to mask the fact that you can't sleep.
Exactly. And of course, let's not forget the role of nutrition.
Ah, yes.
Yeah.
Always a key player.
Table 8.4 lists a whole bunch of nutritional and botanical options that can be helpful for insomnia.
Okay, see, there's CBD oil, melatonin, magnesium, GABA, 5-HTP, L-theanine, and a whole host of herbs like chamomile, lemon balm, kava, passion flower, valerian, hops.
It's quite a list.
It is. But of course, it's always best to talk to a healthcare professional before trying any of these things, just to make sure they're safe and appropriate for your individual situation.
Absolutely. And it's important to remember that even natural supplements can have potent effects and should be used responsibly. For example, 5-HTP, which is a precursor to serotonin, carries a risk of serotonin syndrome, which can be dangerous.
That's a good reminder.
Yeah.
Now, the book mentions that light therapy can be helpful for regulating circadian rhythms, which can get thrown off as we age.
It can be really beneficial, especially for folks who aren't getting enough natural sunlight.
And it also talks about vitamin D deficiency being linked to both depression and sleep issues, suggesting that supplementation might be helpful.
Yeah, vitamin D is so crucial for so many things, including mood regulation and sleep. Making sure your levels are adequate is important.
Makes sense. What about meal timing? Can, when we eat, affect our sleep?
It definitely can. Managing your blood sugar levels through consistent meal timing and healthy food choices can help prevent those middle-of-the-night wake-ups caused by blood sugar dips.
Okay.
And it's especially important for people with reactive hypoglycemia to have a balanced snack before bed to keep those blood sugar levels steady throughout the night.
So we're talking about avoiding those late-night sugar cravings.
Exactly. It's all about working with your body's natural rhythms to get better sleep. Now, the book talks about CBTI, or cognitive behavioral therapy for insomnia, as the gold standard treatment for insomnia in older adults.
I've heard of that.
It's a great option, and it should be covered by Medicare, which is fantastic.
Yeah.
But there's a catch.
Oh.
It can be tough to find providers who are trained in CBT-IND who accept Medicare, so it can end up being pretty expensive for some people.
Oh, that makes sense. So what can people do if they can't afford CBTI?
The book suggests some alternatives. Things like group CBTI and mind-body approaches can be really effective, and they tend to be more affordable. Plus, these can be delivered through telemedicine, which makes them accessible for people who can't easily get to in-person appointments.
That's great. It makes these options more available to people who need them. Okay, let's talk about therapeutic diets. The book discusses several, starting with the Mediterranean diet.
Ah, the Mediterranean diet. It gets a lot of well-deserved attention.
It does.
It's so good for both physical and mental health, focusing on fruits, vegetables, whole grains, healthy fats, and lean protein. There's just tons of evidence supporting its benefits. Lots of studies have linked it to a reduced risk of both depression and cognitive decline.
It makes sense, considering it's all about eating nutrient-rich whole foods. The book even mentions a study called the SMILES study, which found that dietary improvement, specifically through a Mediterranean-style diet, can actually be an effective treatment for depression.
It's amazing to see how powerful food can be.
It really is.
Yeah.
The book also talks about elimination diets. I'm guessing those are all about figuring out which foods might be triggering mental health issues.
Exactly. You basically eliminate those suspect foods and then see if your symptoms improve.
So which foods are usually the culprits?
The common ones are gluten, dairy, corn, soy, and peanuts. By systematically eliminating and then reintroducing these foods, you can pinpoint which ones might be causing problems for you.
Interesting.
It's important to do this under the guidance of a healthcare professional, though.
Right, to make sure you're still getting all the nutrients you need.
Exactly. You don't want to accidentally create more problems by restricting your diet too much. Now, have you heard much about intermittent fasting?
I have. It seems to be getting a lot of buzz these days.
It is, and the book mentions it as a potential tool for improving both mood and sleep.
Okay.
It's not so much about what you eat, but when you eat. It's about cycling between periods of eating and fasting. Research suggests that it could have positive effects on mood and sleep quality, possibly through calorie restriction and its influence on hormones and metabolism.
There are different ways to do it, right?
There are. The book lists a few, like the 5.2 fast, where you restrict calories 2 days a week.
Okay.
And a nightly fast of 12-16 hours. There's also the fasting mimicking diet, or FMD, which is a 5-day fast, but you eat these specific prepackaged meals that mimic the effects of fasting while still providing some nutrients.
Wow, that's interesting. A lot of options to choose from.
There are. And the key is to find a method that works for you and that you can stick with long term. Consistency is key.
That makes sense. Okay, last one, the blood sugar balancing diet. I'm guessing this is all about keeping blood sugar levels stable to avoid those spikes and crashes that can trigger anxiety.
You got it. You do that by focusing on consistent meal timing, including protein and healthy fats with every meal, and avoiding refined carbohydrates and sugary foods.
Okay.
Keeping your blood sugar steady can really have a big impact on your mood.
And the book suggests having a protein and fat-rich snack before bed to prevent those nighttime blood sugar dips that can wake you up, especially for people with reactive hypoglycemia.
It's all about supporting your body's natural rhythms for better sleep.
I like it. Now, before we get to those case studies,
Right.
I want to take a quick peek at Table 8.5, which lists some key micronutrients for psychological support.
Oh yeah, that's a good one. It highlights the importance of omega-3s, magnesium, B vitamins, vitamin A, and ashwagandha for keeping your mental health in tip-top shape.
It's amazing how even small deficiencies in these nutrients can really affect our mental well-being. Okay, you ready to dive into those case studies?
Let's do it. I love seeing how all of this plays out in real life.
Me too. The first case study is about Alex, a 72-year-old engineer who'd been struggling with depression since his wife passed away 3 years ago.
This one really highlights how complex depression can be, especially when it's tied to grief and loss.
Right.
It's not just about the emotional impact, it's the physical and nutritional factors that play a role too.
Alex had other health problems too, like high blood pressure, constipation, and pretty bad osteoarthritis in both knees. He was overweight, and his blood work showed that his B12 was borderline low, his DHEA was low, and his C-reactive protein was elevated, which means inflammation.
Right.
Genetic testing also revealed that he had a variant in the MTHFR gene.
Oh, okay.
That one can make it harder for his body to convert folic acid into the active form it needs.
It's pretty common, actually, especially as we age. You start to see multiple health conditions, medications, genetic predispositions. They can all interact in these really complex ways.
It definitely makes things more complicated. His diet had gone downhill since his wife passed away, too. He was relying more on pre-made meals and just didn't have the energy or motivation to cook.
Understandable. Grief can be so draining. It affects you physically and emotionally.
He wasn't ready to go back to traditional therapy, which I get. But he was open to joining a mind-body medical support group for people dealing with depression, anxiety, and insomnia.
Oh, that's great. Group support can be so beneficial. It creates a sense of community,
Yeah.
Like you're not alone in this.
Exactly. Instead of overwhelming him with a strict diet, the practitioners just recommended he buy better quality pre-made meals.
I like that. Meet him where he's at.
Right. They recognize that small, manageable changes can be more sustainable, especially when someone's struggling with depression.
It's all about progress, not perfection.
Exactly. They also adjusted his supplements, started him on magnesium citrate for his constipation and to help him sleep better,
Okay.
a high-potency B complex to address those deficiencies and support his MTHFR gene variant. Same for low energy, his osteoarthritis, and the depression. DHEA for his deficiency, and a highly concentrated curcumin supplement to tackle the inflammation.
They really took a targeted approach, addressing his specific needs.
They did, and the results were pretty remarkable. Over the next 3 months, he started having more energy, which allowed him to get back to biking.
Oh, nice.
Yeah, it was something he used to love doing with his wife. His constipation cleared up and his knee pain lessened. His blood work even showed positive changes. His B12 and DHEA levels went back to normal, and his C-reactive protein, that inflammation marker, went down.
It's a perfect example of how lifestyle changes, targeted supplementation, and addressing those nutritional deficiencies can create a ripple effect. It can improve both physical and mental health.
And here's the best part. A year later, he came back to the clinic with a new girlfriend. He was in such great spirits, active, had a whole new social circle.
That's fantastic. It just goes to show that these interventions can really have a profound impact on someone's life, way beyond just symptom relief.
I love that story.
Okay.
Let's move on to our next case study, featuring Susan, a 71-year-old teacher who'd been dealing with severe chronic anxiety for decades.
This case really highlights the challenges of long-term anxiety and the importance of exploring different treatment approaches.
Especially for older adults.
Yes, absolutely.
Her anxiety was so bad she was practically housebound.
It can be so debilitating. And what's more, her anxiety was intertwined with other health issues.
Oh, like what?
She had restless leg syndrome and neuropathic pain in her legs.
Neuropathic pain,
It's a constant stinging, burning kind of pain.
Oof, that sounds awful.
It is. And of course, all of this just added to her sleep problems and anxiety.
Yeah, it's like one thing just feeds into the next, creating this vicious cycle. So how is she coping with all of that?
She was seeing both a primary care doctor and a neurologist and had tried different medications over the years. Lyrica and lorazepam gave her some relief, but like often happens with long-term medication use, the effectiveness kind of wore off over time.
It's a common problem.
Yeah.
Our bodies adapt, so we might need higher doses or different medications to get the same effect.
Right. It really highlights how important it is to keep evaluating and adjusting treatment plans, especially for chronic conditions. Now, besides medication, Susan had also explored other options like acupuncture, massage, and gentle yoga.
Okay.
She found those helpful for her leg pain and anxiety, but she couldn't afford to do them regularly.
That's a common barrier for a lot of people. Alternative therapies can be expensive.
They can. And sometimes it's those little details that can make a big difference in a case. Like Susan had a major sweet tooth.
Okay.
She admitted to having dessert with every meal and would get these intense sugar cravings, especially after dinner.
I can relate to that. A little something sweet after dinner can be so comforting.
Right. Well, Susan developed this nightly ritual of having a cup of ice cream before bed.
Yeah.
She was convinced it helped her relax and fall asleep.
I see where this is going. Sugar rush, energy spike, followed by a crash. Not exactly a recipe for restful sleep.
Exactly. And those blood sugar swings can actually make anxiety worse.
Wow.
So the practitioners recognized that they needed to address both Susan's anxiety and her reliance on sugar. It had to be a multifaceted approach. They suggested she try microdosing medical cannabis in the evening, specifically a blend with a high ratio of CBD to THC.
Now, I've heard a lot about CBD for anxiety. What exactly is microdosing and how does it work?
Microdosing is all about taking very small amounts of a substance to experience its subtle effects without the psychoactive high that's associated with THC. You basically use just enough to get the potential benefits without feeling intoxicated.
Interesting.
They also recommended that she take a little more CBD in the morning to get added anxiety relief throughout the day.
So it's like a two-pronged approach, using CBD strategically throughout the day to manage her anxiety levels.
Precisely. And that wasn't all. They also started Susan on magnesium citrate at bedtime.
Okay.
To help relax her muscles and promote sleep. And for those moments when anxiety threatened to take over, they suggested sublingual liposomal L-theanine. It's a form that's absorbed quickly and can be taken as needed.
So it's like having a toolbox of different options to manage your anxiety depending on the situation.
Exactly. And to add to her support system, they also encouraged her to join their weekly mind-body telemedicine group. It was a chance to practice guided meditation and connect with others who were facing similar challenges.
That's so important. Just knowing you're not alone can make a world of difference. So what were the results of all these changes?
They were remarkable. After just 3 months, Susan reported that her anxiety was completely under control. And she was able to afford more regular massage and acupuncture sessions. That combination of mind-body practices, the cannabis, magnesium, and those occasional sessions, it really made a difference.
That's so great to hear. It shows how powerful a holistic approach can be, addressing both the physical and emotional aspects of anxiety.
And the benefits went far beyond just symptom management. Years later, she was still attending those group classes and reported a much improved quality of life. Even her chronic pain had subsided, allowing her to be more active.
It's so inspiring to see how these interventions can have such a lasting positive impact. Now let's move on to our final case study. This one features John, a 68-year-old man battling a whole mix of health challenges.
Okay.
He had obesity, depression, insomnia, hypertension, and coronary artery disease.
This case really emphasizes the complexities of treating insomnia in older adults, especially when multiple health conditions and medications are involved.
It sounds like a real puzzle. His medical history sounds pretty extensive. What medications was he taking?
Oh, quite a few. He had a history of multiple stents due to his coronary artery disease.
Wow.
He was on hydrochlorothiazide, lisinopril, clopidogrel, Cymbalta, and a high dose of atorvastatin.
That's a lot to manage. What brought him to the clinic?
In the year leading up to his appointment, John's use of zolpidem, a sleep medication, had become an issue.
Okay.
His internist was hesitant to refill his prescriptions early.
Makes sense.
And his wife, Sarah, was worried about how much he was relying on the medication.
I can understand why. Sleep meds can be helpful in the short term, but long-term use can lead to dependence and even something called rebound insomnia, where the sleep problems actually get worse when you stop taking the medication.
Exactly. It's a slippery slope. And things came to a head when John fell during a nighttime trip to the bathroom, breaking several ribs.
Oh, no.
He'd been disoriented from the zolpidem.
That's a scary reminder of the risks associated with these medications, especially for older adults. So what happened next?
During his intake assessment, they discovered that John was actually mixing the zolpidem with a shot of whiskey every night.
Oh, wow.
He thought it would enhance the effects of the medication.
That's a dangerous combination.
Yeah.
Alcohol and sleep medications can interact in unpredictable ways.
Very dangerous. And to complicate matters further, he was a regular coffee and tea drinker, even having a strong cup with dinner around 7 p.m.
Late-night caffeine. Not exactly a recipe for good sleep.
Mm-hmm.
So how did they approach this complex situation?
They knew they had to take a harm reduction approach.
Okay.
Asking him to completely stop drinking and having caffeine just wasn't realistic.
Right.
So they compromised. He agreed to have his whiskey with dinner instead to avoid that dangerous mix with the zolpidem and to stop all caffeine after lunch.
So acknowledging his habits while minimizing the potential harm.
Exactly. Now, to replace that nightly ritual of zolpidem and whiskey, they came up with a clever solution. They made a special blend of valerian tincture, CBD oil, and magnesium citrate for him to take at bedtime.
I love that. It's like tapping into the power of ritual while incorporating ingredients that are known to promote sleep.
Exactly. And along with cutting out the late-day caffeine and separating the alcohol from the zolpidem, they were able to safely lower his zolpidem dose by half.
Wow, so multiple changes working together.
Exactly. What happened at his follow-up appointment?
8 weeks later, John said he felt way more energetic during the day.
Oh, that's great.
It is. And even though he wasn't actually sleeping any longer, the quality of his sleep had definitely improved.
That makes sense. Sometimes it's not about how much you sleep, but how well you sleep.
Exactly. And get this, his blood pressure, which had always been high, had actually gotten much better.
Wow, so maybe improving his sleep actually helped his blood pressure too.
It's certainly possible. So because of that, and because he was getting up a lot during the night to pee, they decided to stop his hydrochlorothiazide, which is a diuretic. Those can sometimes mess with sleep.
Interesting. So they were able to simplify his medication routine and address the underlying cause of his sleep problems. I like it. What happened at his next appointment?
At his 3-month checkup, he was a different person. Happier, more energetic. His mood had totally shifted. He even came in with a big smile, a hug, and a heartfelt thank you for the practitioners.
Oh, that's so sweet. It sounds like a complete transformation.
It really was. Stopping that diuretic also got rid of his nighttime bathroom trips, which further improved his sleep. And even without that medication, his blood pressure stayed stable.
It's amazing how addressing one issue, in this case, his sleep, can have such a positive domino effect on other aspects of his health.
Totally. These case studies really show the power of a holistic, personalized approach. It's about giving people the tools they need to take control of their own healing.
It really is empowering. These stories are so inspiring. They highlight the potential for real, lasting change when we look beyond conventional treatments and embrace a more integrative approach to health and well-being.
They really are. And they show the value of personalized care that takes into account each individual's unique needs, preferences, and circumstances. It's not one size fits all.
Not at all. This deep dive has been incredibly insightful. It's remarkable how much valuable information is packed into just one chapter. It's a testament to the growing field of integrative geriatric nutrition and the recognition that food and lifestyle are cornerstones of healthy aging.
I agree. Before we wrap up, I want to go back to that thought-provoking question we mentioned at the beginning. If 95% of our serotonin is made in the gut, how could prioritizing gut health be the first step towards better mental and emotional well-being? What are your thoughts on that?
It's a question that really challenges us to rethink how we approach mental health. If most of our serotonin, which is so important for mood regulation, is produced in the gut,
Right.
then it makes sense that the health of our gut microbiome plays a central role in how we feel emotionally.
It's a reminder that our gut isn't just responsible for digestion. It's deeply connected to our brain and impacts our thoughts, feelings, and even our behavior.
It's a two-way street. The gut-brain axis is this intricate communication network that allows constant interaction between these two vital systems. What happens in the gut can affect the brain, and what happens in the brain can affect the gut.
So it sounds like if we want to support our mental health, prioritizing gut health through our diet, lifestyle, and targeted interventions should be at the top of our list.
Absolutely. It's about nourishing those trillions of bacteria that live in our gut,
Right.
creating a flourishing ecosystem that supports not just our physical health, but our mental and emotional well-being as well.
This deep dive has given us so much to think about and explore. It's a reminder that we have more control over our health than we often realize.
We really do. By making conscious choices about our diet, our lifestyle, even the supplements we choose, we can set off a chain reaction of positive changes that go way beyond just relieving symptoms.
It's about taking an active role in our well-being and embracing a holistic approach that recognizes the interconnectedness of our mind, body, and spirit.
Exactly. And this is just the beginning. There's so much more to learn and discover. So keep learning, keep experimenting, and most importantly, keep listening to your body.
Great advice. Thank you so much for joining us on this fascinating journey into the world of integrative geriatric nutrition. We hope this deep dive has inspired you to prioritize your gut health and explore this incredible connection between nutrition, psychology, and sleep.
Remember, knowledge is power, and with this understanding, you can make informed choices to support your well-being and create a more fulfilling and vibrant life.
Until next time, keep diving deep and keep exploring the fascinating world around us. It's amazing to see how these seemingly small changes can make such a huge difference, not just in managing symptoms, but in actually improving people's overall quality of life.
It really underscores the idea that true healing goes beyond just treating the physical body. We have to nourish the whole person. Mind, body, and spirit.
This deep dive has been eye-opening, to say the least. It's incredible how much we can learn from just one chapter of a book.
It speaks volumes about the growing field of integrative geriatric nutrition and how important food and lifestyle choices are for healthy aging.
Absolutely. Now, before we wrap up, I want to circle back to that thought-provoking question we touched on earlier. If 95% of our serotonin is made in the gut, what does that tell us about the importance of gut health for our mental and emotional well-being? What are your thoughts on that?
It's a powerful question that really makes us reconsider our whole approach to mental health. I mean, if the majority of our serotonin, which is so crucial for regulating mood, is actually produced in the gut,
Right.
then it logically follows that the health of our gut microbiome plays a huge role in how we feel emotionally.
It's like a light bulb moment.
Right.
Our gut isn't just about digestion. It's intimately connected to our brain and influences our thoughts, feelings, and even our behaviors.
It's a two-way street. That gut-brain axis we talked about is this incredible communication highway between those two systems.
Right.
What happens in one can directly impact the other.
So it sounds like if we're serious about supporting our mental health, we need to make gut health a top priority. That means paying attention to our diet, our lifestyle, and even considering targeted interventions like those we discussed.
I couldn't agree more. It's all about nourishing those trillions of bacteria that call our gut home. Creating a thriving ecosystem that not only supports our physical health, but also our mental and emotional well-being.
It's about taking a holistic, integrated approach to health.
Exactly. And this is really just the tip of the iceberg. There's so much more to learn and explore.
There is. So keep learning, keep experimenting, and most importantly, keep listening to your body. What's it telling you?
That's such great advice.
Well, thank you so much for joining us on this deep dive into the world of integrative geriatric nutrition. We hope this episode has inspired you to take a closer look at your gut health and explore that fascinating connection between nutrition, psychology, and sleep.
Remember, knowledge is power. And the more you know, the more you can make informed choices that support your well-being and help you create a more fulfilling and vibrant life.
Absolutely. Until next time, keep diving deep, keep exploring, and keep those questions coming.